I want to thank everyone for joining me. My name is Carolyn Curtis. I am the CEO and founder of the Carib Company. I am very concerned about all of the reports that we're hearing in regard to maternal deaths. And particularly what we're seeing is that there's a major increase of deaths among Black women. And so as I kick off my 30-day daily videos, we're going to go through a number of topics to really take a look at this and look at how women, their partners, husbands, and families can begin to understand some of this, to if they're planning to have babies, that they can be more prepared for a healthy pregnancy and a healthy outcome, and also kind of take more charge and take action about the kind of care that they're going to receive during this time. So let's take a look at all of this. So why are women dying? Well, first of all, let's understand all this terminology. The reports are given by reporting what's called a maternal mortality ratio. And what that is the number of women who die per 100,000 live births. And this ratio is used throughout the world. It helps to measure the health of a country. And so when you start to see the maternal mortality ratio going up, it makes you sit up to say, what's going on? And also, this is the number of women who are dying by the first 42 days, or what we would call that 6-week checkup, 42 days, 6 weeks after they've had their babies. So we're looking at deaths from the time of during pregnancy up to 6 weeks after they've had babies. What has happened in the United States is that the rate for maternal mortality ratio has gone up, but it has gone up really high for Black women. Overall rate is 32 women. Overall, this is the whole population, 32 women per 100,000 live births. That is what it is, and the most recent data is from 2021. That's the overall, meaning all the population, Black, white, Hispanic, everybody. But for Black women, it's 69.9. That is more than twice the amount. And this is what's making people really sit up. And the thing of it is that it has increased from the previous year. So who is dying? When you look at who's dying, what you will see is that women who are in the ages of 25, under 25, pretty much that is going up a bit. For Blacks, it's 69.9 women per 100,000 live births dying in that age group. But when you get to the age group of 40 and over, it is over 300 women. And it's really climbed for Black women. When are these deaths occurring? Surprisingly, these deaths are happening during pregnancy and in the first 7 days, first week after the mother has had her baby. 47% of deaths are happening during pregnancy and the first week after the mother has had her baby. 53% are happening after that first week up into the first year. Why are women dying? What are the reasons? Think, guess. Any wild guesses? You would be surprised. The leading cause for death for women is mental health. Believe it or not, mental health. 23% of moms are dying due to mental health, either suicide, due to overdose, or poisoning that has occurred due to substance abuse. This is happening more in the white population. The second largest cause is hemorrhage, where you're bleeding too much after you've had a baby. This is accounting for 14% of the maternal deaths. And when you look around the world, this is one of the top reasons why women around the world are dying. And I've always thought if we can get a handle on this one reason, that would be. So what makes it a hemorrhage? A hemorrhage is when a woman has lost about half a quart of blood after she's had a baby. Cardiac problems, heart problems is causing 13% of the maternal deaths. I forgot to say with hemorrhage that is affecting the Asian population more so. And with the cardiac conditions, that is affecting the Black population more. 9% of women are dying due to blood clots, and 9% of women are dying due to what's called cardiomyopathy. Big word, cardio is heart. It is a problem with the heart muscle itself. That's what's causing. So these are the reasons. And the thing of it is that these are preventable reasons. 4 out of the 5 reasons are preventable. So what can we start looking at and doing with this? So there are things known as maternal mortality review committees. These are committees that have been recommended by the Centers for Disease Control, that they are in every state or in localities. And what these committees do, they're consisted of like a number of professional organizations, such as the American College of Obstetrics and Gynecology. It represents midwives. Also, hospital associations are part of this committee. You also have persons such as midwives, OBGYN doctors, pediatric doctors, doulas, and sometimes community members. Community members really ought to be on these committees to really understand and to say what's going on. The community knows what's happening. What they do is they take a look at records to see what has happened, what was the type of services that were received, were the type of referrals that were provided. The whole thing of it is to be very careful that you're not pointing fingers, but to really look at what has happened. Why did this mother die? And so I looked at the report from Washington, D.C. Their last report was for 2022. And what they found out was that there were a number of barriers for women to be able to get care due to structural racism. Yes, structural racism. And when I listened to a show that was on WAMU 88.5 this evening, just before coming on with this broadcast, they were talking with a midwife in North Carolina. And in North Carolina, she was stating that the reason that she thought some of the problem was that the doctors and the midwives are very busy. When you look at the caseload of patients that they need to see, it's jam-packed for the day. So they don't have the time to sit and to review every individual chart to kind of be caught up to, caught up with everything that's happening with each woman that they see. The other reason that came across is providers need to listen to women. Listen to what women are saying to you. They know their bodies. They know when there's something different. But so often women don't feel that they can make their voice be heard. They try to they're concerned or sometimes scared to talk to the providers about what's going on with them, or may not know how to articulate or say what they need to say. And the recommendation that this midwife said is, if you feel that you're not being heard, you take it up to the next level. If you're not getting heard there, take it up to the next level, up until you get your questions answered, until you know that someone has heard you. Other recommendations that were made by the maternal mortality review committees is that this is for Washington, D.C. They're able, with the maternal mortality review committees, able to identify where these deaths are occurring in their particular location jurisdiction. Their recommendation was to increase the number of social workers within the hospital so that they're able to help women and their families get the kinds of services that they need to have. To do home visits, either phone calls or home visits after delivery. Remember, a large number of deaths are happening during delivery and in the first 7 days after you've had the baby. And also to provide medications that have been prescribed during that hospital time to make sure that those medications are provided on the same day that that woman is leaving the facility. My recommendations, I have a little mantra: cut. Know yourself. Know what your body is, your blood pressure, your pulse, your normal lab values for yourself. Understand the system. Understand how this health system is working. Understand, what is the cesarean section rate? How do these nurseries operate? How do you pay for care? Understand the system. And the T is to take action. If you feel that there's something that's not quite right with you during your pregnancy or at the time that you're planning to have your birth, speak up, take action. And so that is my presentation for today. We're going to be talking about maternal death and how to work with this. My goal is hopefully families will be able to come out of these 30 days with better information of how to prepare for a healthy pregnancy and have good outcomes, and to really understand that you are the one who's paying that bill. You're the one who's hiring really the person to help take care of you during this time. We need to flip the switch on our thinking around this. So, as was mentioned, structural racism was one of the problems. Tomorrow, we're going to talk about racism in medicine. So thank you so much. I hope that this was helpful information. I look forward to talking with you again tomorrow. Thank you. Have a great evening.